Hello to everyone, and in this video we'll be discussing on the topic of tumor lysis syndrome. And this syndrome is a type of tumor cancer cell deposition which are released in the bloodstream and affect your organ, that is kidney. So it is an urgent situation in which a significant number of tumor cells die within short period of time and releasing contents into the bloodstream. So this is a basic definition for this tumor lysis syndrome. And at the same time, cancer cells are also so quickly removed that the kidneys are not able to remove the released substance from the blood. So the number of cancer cells are so high that the kidney can't remove all the cancer cells at the moment, and because of that there are problems in the kidney, can further lead to your renal failures and other kidney pathologies. Now when cancers are lysed, that is destroyed, when cancer cells are destroyed, they are release substances such as potassiums. The potassium levels will be high, your phosphates will be high, and your nucleic acids will be high. And TLS is a group of disorders that includes high concentration of uric acid, potassium, phosphate in blood, and low level of calcium. And because of that there is accumulation of uric acid, potassium, phosphates, and low level of calcium. So these are the three conditions that are called as hyperuricemia and hypophosphatemia and hypocalcemia. So these three conditions you will see in this case. Now hyperuricemia, what is it? It is an uric acid can be deposited in the joints and can lead to gout. So gout is a pathology that can occur with the tumor lysis syndrome in the patients, and can also lead to formation of stones due to the accumulations of your uric acid in the kidney, and later on or in the chronic stage that can lead to your kidney stones. Okay, so that are called as, and further lead to acute kidney damage, and sharp your vasoconstriction will occur in the kidney. Okay, so these are the three, as I told you, potassium, phosphates, and nucleic acid will be the substance released in the kidney after tumor lysis syndrome. Now hyperphosphatemia is also a condition in which the phosphates will be high, and this type will be a secondary, and this can lead to secondary hypocalcemia. Because of hyperphosphatemia there will be the occurrence of secondary hypocalcemia, and which can lead to tetany, arrhythmias can occur, seizures. So these are the pathologies you can see in the patients, and can also deposit as calcium phosphate in different other organs. And damage to kidney and renal failure are common, as it is affecting your kidney. And third condition will be hypocalcemia and hyperkalemia. So this will affect your heart rate, and fatal arrhythmias will occur due to your hyperkalemia, increase in the level of your potassium. Now when does this tumor lysis syndrome develop? So this does not develop in all the cancer patients, but this developed in the following cases, such as in the patients with large pool of cancer cells, that is with large tumor, the size of tumor is very large, and widespread metastasis. So meaning is that if the cancer is large, or if the cancer has the ability to widespread metastasis, that is to go to the other organs, so in those cases there is chances of development of TLS. Now for tumors of rapidly dividing cells, acute leukemia, the most common tumors in which we see TLS are acute leukemia, high grade of lymphoma, and myeloproliferative disease. Now other solid tumors we see is hepatoblastoma, this is a cancer of liver, and stage 4 of neuroblastoma, the cancer of brain, and the cancer that causes kidney dysfunction before treatment. So the cancers which cause any type of kidney dysfunction before the treatment of that cancers, and so those cancers are also prone to develop TLS. And third point is that for tumors that respond well to therapy, so the tumors which are responding well to the treatment or radiation therapy or any type of chemotherapy, so they have also chances of development of TLS. How? So they can occur spontaneously even before start of the treatment, and oftenly after the start of therapy or after 2 or 3 days, like treatment like chemotherapy, radiation therapies. So in those cases there are chances of development of TLS, and can also develop in patients with steroid therapy, so who are on the patients who are on steroids or targeted hormone therapy. So these are the patients who can develop TLS. Okay, this much is clear. Now you can see this image here. So in this image you can see, as I told you, these will be deposited in the blood, like hyperkalemia, high potassium levels in the blood, hyperuricemia, excess uric acid in the blood, hyperphosphatemia, excess phosphate in the blood, and calcium will be low. Okay, So these are the conditions you will see in the patients with acute tumor lysis syndrome. And now this flow chart, you can see this as chemotherapy has been done, DNA breakdown, and because of that there is hyperuricemia, hyperphosphatemia, hypocalcemia, and because of this overload to the kidney, this can lead to renal failures, and due to the levels of this ions, there can be the development of cardiac dysarrhythmias and neuromuscular irritability. And these are the criteria for hemodialysis, like serum potassium should be more than milliequivalent, serum uric acid, creatine, phosphorus, volume overload, and symptomatic hypocalcemia. So these are the you will see in this patients. So hyperkalemia. Now symptoms you will see. What are the symptoms you will see? So symptoms like nausea will be there, with or without vomiting. Diarrhea will be there. Pain in the abdomen, nearly about towards the kidney side will be the pain, and lack of appetite, weakness, darkening of the urine, and the volume will be also decreased of urine. Seizures will be there, numbness will be there, and some types of goosebumps will be there while you are working or doing some work. And there will be hallucinatory delirium also, and rapid heart rate and arrhythmia, as I told you. These are the complications of TLS, the fatal arrhythmias. Now treatment will be like diuretics you can give. Diuretics can be prescribed to the patients, and patients can given the medications with reduced uric acid production. Okay. And the second treatment is like if you talk about the surgical or any type of better treatment, we have the priority, we have the hemodialysis in the severe stage. So that are done by your blood analysis test. The levels are checked of potassium, creatine, and phosphorus, calcium. So these are checked. If there are high number of toxic substances in the blood, then hemodialysis will be prescribed to the patient. So this will be the better treatment for the patients. And if not treated, then can lead to the major complication, which is your acute renal failure. So this was your tumor lysis syndrome. Thank you.